Hello. Hi, I'm Abigaile. I'm going to do a quick report on the overdiagnosis of attention deficit hyperactivity disorder. I'm going to format the information so you can use it to fill out one of your response templates for case presentations. We're going to go a little out of order on that form, so please just bear with me. In place of the first name of observed subject, I suggest the subject of this report, overdiagnosis of ADHD. The first problem we face is that diagnostic criteria are functionally vague. In the DSM-5, the American Psychological Association calls ADHD a behavioral condition that makes focusing and routines challenging. People have trouble getting organized, staying focused. The full definition contains phrases like has difficulty sticking to tasks, fails to finish things. That's really open to interpretation. You don't hear anything there on how to measure staying focused or how many things one must fail to finish. This could be one reason child and adolescent psychotherapists don't really use the DSM criteria when making this brand name APA DSM diagnosis and labeling these kids with this disorder. Only 1 in 4 say they actually check the criteria. So here I would make notes on your template where it asks for age, gender, grade, and ethnicity. Age, 2 and above. Gender, significantly more males, so I would put male. For grade, kindergarten and up, I would say. Most kids only get their behavior labeled abnormal when they're first put into a school-like environment. And for ethnicity, put white. White children are more likely to be diagnosed with and prescribed for ADHD, this disparity being partly due to the lack of health insurance and care for minority families. Please listen to the following symptoms of ADHD and see if it sounds like any 4 to 5-year-olds you've met. Meanwhile, jot down several of these for section 2 of your template. Okay? Impulsiveness, poor time management skills, disorganization and problems prioritizing, problems focusing on a task, trouble multitasking, excessive activity or restlessness, low frustration tolerance. Have you ever met a well-organized 5-year-old with a high frustration tolerance? Me either. Let me say here that I don't mean to disregard the diagnosis entirely or invalidate people with ADHD, nor undermine the use of prescription meds for kids with extreme behavioral disturbances. But with almost 400,000 kids between the ages of 2 and 5 diagnosed at this point, I think it's clear we have a problem. There's an excessive reliance on psychotherapists on heuristics while diagnosing. That's similar in a way to a cliche. It's what sounds true or feels true or has typically been true in the past. The tendency to diagnose a boy and not a girl for the exact same behaviors is often based on a heuristic, for example, about the need to control male aggression. Another big obstacle to precise diagnoses is there's no agreed upon instrument for diagnosing ADHD. This goes hand in hand with the fuzzy criteria issue, and here's a list of just some of the diagnostic instruments that are currently commonly used. It's not that they're not quality, it's just that they are quite varied. So I recommend that you write down 2 or 3 of these for your section 4 assessment tool / instrument. So we have the Vanderbilt assessment scales, the behavior assessment system for children, which is known as BASIC, BASC, Barkley home and school situations questionnaires, Connor's parent and teacher rating scales, and the Achenbach child behavior checklist. Just a few, to name a few. Another reason for overdiagnosis is the relative age effect. The last children to be born within the cutoff assigned for a given grade are almost exactly a year younger than the earliest born kids in that cohort. Kids born just before that cutoff date are 30 to 60% more likely to be diagnosed with ADHD, twice as likely to be prescribed psychostimulants than kids born just days later. In kindergarten. How insane is this? And it gets worse as they get older. So, one meta-study found that about 1.1 million children have received an inappropriate diagnosis of ADHD, and over 800,000 kids have been prescribed stimulants due exclusively to that relative age immaturity. Man, I thought I had to grow up young. Jeez. Confounding factors. That means other conditions that may exist to make an accurate diagnostic difficult. They account for a huge number of misdiagnoses. So I recommend that you note several of these in your response section 3 where it says diagnosis. Some confounding factors of ADHD are epilepsy, trauma, sleep disturbances, immaturity, highly gifted children, psychotic children, learning difficulties, schizophrenia, mood disorders, etc., etc. Lastly, please go back up to the top of your response sheet and enter several of these in section 1. Now we are listing holistic approaches to ADHD treatment. Some suggestions that have been found to help include adding additional outdoor activity and exercise, enriched educational programs, light therapy, dietary interventions, natural supplements and vitamins, behavior analysis, my favorite, to investigate the motivations supporting individual problem behaviors, and therapies such as family therapy and cognitive behavioral therapy. So, in summary, as child advocates and itinerant staff, we should do whatever we can to ensure that all alternative diagnoses have been ruled out before labeling a child with ADHD, and hopefully we can employ some of these alternative approaches, the holistic approaches, before we resign ourselves to medicating away a child's problem behaviors. So for the last section on your form, I would list 3 of your favorite holistic interventions, or maybe some that you can think up yourself. Who knows? You might be coming up with the innovation that will help the next child in need. So thanks so much for watching, and stay safe and be well.